Welcome to the T-Level Health Core Assessment Employer Set Project Task 2P Healthcare Plan Overview. In this presentation, we will guide you through the details and key considerations for Task 2B. Please remember that the information provided here is based on data available as of September 23 and may not reflect future changes to guidance documents. Always refer to the most up-to-date guidance. Let's begin with an overview of Task 2B. So you continue to act as a support and health worker within a multidisciplinary care team, aiming to help achieve individual care goals. This task is part of a broader project that follows one individual's healthcare journey. Task 2B occurs within a 2-week assessment window and requires approximately 2 hours and 30 minutes to complete. Students will work under supervised conditions with access to research from pre-release research activity and notes from Task 2A. They will also have a healthcare plan template. Students' evidence for this task is the completed healthcare plan template. So understanding how Task 2B fits into the broader project is crucial. In the preparation research, students continue to focus their research on the current brief, but consider what evidence they'll need for upcoming tasks. Task 2, use the post-discussion reflection time effectively to create notes that will support the creation of the healthcare plan. Task 2B is the creation of the healthcare plan. The students' project is beginning to take shape. Students will utilise their notes from supportive discussions, reflections and feedback from Task 2A to build a comprehensive healthcare plan. Task 2B, bring all these components together to justify the actions they are implementing and consider what changes the students will make based on feedback. And finally, for Task 4, students will reflect on whether they used their pre-research effectively and built a solid foundation for their research. And consider factors such as how did the supportive discussion and subsequent note-taking in Task 2A affect their creation of an effective healthcare plan. This task links to CS1, demonstrating person-centred care skills when planning, developing and providing care to ensure the needs of individuals are met. CS2, communication, being able to communicate effectively with parents, carers, service users and other health and social care professionals using a range of techniques to overcome communication barriers. And CS3, team working, identify the function of different teams as well as their own role and demonstrate collaborative working to maximise success. In this type of assessment, students should consider the following tips to effectively demonstrate these core skills. Students should include specific timeframes for when support action will be provided and when reviews will take place. They should recognise the healthcare plan should be dynamic and updated to accommodate changing needs. Students should identify and address potential risks associated with care and support actions. They should include safeguarding measures to protect the individual from harm. Students should develop a comprehensive understanding of creating and structuring a healthcare plans, familiarise themselves with various healthcare plan formats used in healthcare sector, and they should practice creating healthcare plans for different individuals before assessment. Students should acknowledge that as a practitioners, they can't meet all the patient needs alone. They should identify external support providers who will be involved, specifying their role, for example, speech therapist, counsellor, physiotherapist. They should identify and justify the involvement of other professionals or support personnel in the healthcare plan. Students should ensure that the care and support plan incorporates all person-centred care concepts, document the individual's care and support needs, covering physical, emotional, social, cultural and spiritual aspects, adapting strategies to match the individual's situation and goals, and conduct risk assessments and safeguarding measures relevant to the chosen individual. Students should document healthcare plan information using clear language and terminology. They should record compliance with health and safety procedures, communicate ongoing updates, review dates, assessments, key workers and primary contacts. Students should identify the roles and responsibilities of other key workers involved in the individual's care requirements, explain their role and how they contribute to the plan's success. They should demonstrate their own responsibilities within the healthcare plan and their role as part of a team. Let's explore further how to maximise student success. So we're going to use for the next task, we're going to use the Autumn 23 grade exemplar alongside the descriptor bands for band 3 and 4 marking criteria and the examiner commentary for the tasks to highlight key areas that can maximise success. So using this as an example process, this could also be applied to the C and E exemplar, giving a way to measure student achievement. So let's apply this here. So we've got the chief examiner's commentary on the student works, which can be summarised and was cross-referenced with the grading bands, as well as the indicative content. So in relation to this student, they had a comprehensive person-centred care planning, evidencing grading band 4 criteria. It was well considered, coherent and relevant healthcare planning linking to person-centred care. It includes additional details such as risk assessments for home and work, adaptations, realistic timescales and monitoring. In regards to justified rationale for recommendations, again, a grading band 4 criteria was evidenced. Recommendations are highly justified and reference individuals' goals derived from the role play. The plan addresses key issues raised in the role play, and the rationale for recommendations are clear and reference individuals' goals, albeit with some room for improvements. And finally, for our next application of written communication, again, evidence of band 3 criteria. So while achieving band 4 in clear planning, the student's application of English is not rated as excellent. Some content is copied and pasted unnecessarily. To strengthen the band 4 performance, the student should consider enhanced written communication skills and avoid redundant content. And finally, for detailed roles and multidisciplinary team considerations, the students evidenced that grading band 4 criteria again. They considered their own role within the multidisciplinary team. However, again, there is room for improvements in providing more precise details about other professionals involved, particularly the role of the occupational therapist. To achieve stronger band 4, the students could offer more clarity regarding the roles within the team, specifically distinguishing between occupational health and occupational therapy. So overall, the key themes in the Task 2B of the Health Core Employer Set project from the Chief Examiner reports can be summarised as follows. Successful plans took a holistic approach to patient information and effectively incorporated insights gained from Task 2 interactions. Students who conducted thorough research and demonstrated an understanding of safeguarding and risk assessment achieved higher marks. Many students were limited to mark band 2 due to absence of timescales in their plans. Although some robust plans were created, they lacked detail on how monitoring and review would occur, such as medication review. The inclusion of appropriate timescales for proposed actions was emphasised. Effective plans demonstrated consideration of monitoring and review processes. However, some plans included inappropriate timescales, for example, excessively long waiting times for prescription, indicating the need for realistic timelines. Students often included more detail in the information sections of the plan and less detail in the plan itself. This imbalance restricted the number of marks attainable for this task. And many examples of work showed issues in spelling, punctuation and grammar. There was a lack of proofreading before submission, indicating a need for improved attention to written quality. So to summarise, successful plans integrates insights from Task 2 interactions into holistic client plans. Thorough research, consideration of safeguarding and risk assessment and a holistic approach was crucial. Timeframes for actions and monitoring were essential but often omitted. Plans required appropriate timescales for actions, emphasising realistic timelines. Plans often lacked balanced detail across sections. SPAG issues and lack of proofreading indicated a need for improved attention to written quality. And considerations of roles in the multidisciplinary team was required. Students need to specify roles of other professionals, particularly the occupational therapist, and clarify team roles. Thank you for watching. We wish you success in the T-Level Health Core Assessment Employer Set project.